In 1924, emerging from the devastation of the First World War and the global flu pandemic, people were facing the future with optimism and hope. In medicine, millions of people were given hope with the Nobel Prize-winning discoveries of insulin in 1923 and the electrocardiogram in 1924. A $500,000 Rockefeller grant to the University of Alberta for medical training fueled optimism. In 1924, the Department of Medicine was founded, with McGill-trained neurologist Dr. Egerton Pope as its head. The hope and optimism that sparked the beginnings of the Department of Medicine have, over the past century, created a powerhouse of achievement, with a legacy of pioneering inspiration and international recognition.
Garlic King, he was a visionary person. He was one of the first person to practice critical care medicine in Canada. He was the first one to introduce the technique called bronchoscopy in Canada.
My proudest achievements have been the discovery of a first oral antivirals that we could use for the treatment of hepatitis B. And working with Dr. Kneedeman and Mercer, we came up with an animal model for hepatitis C. Establishing the Li Ka-shing Institute of Virology, we managed to bring in, as a Canada Excellence Chair, Dr. Michael Houghton. He was named one of the 3 winners of the Nobel Prize in 2020.
I helped foster the emergence of this place as a multi-organ transplant center. We established a clinical trials center here and participated a lot in the international studies to apply new knowledge to patients. But the centerpiece of it all was the clinical program. Always, we were aiming for excellence at improving transplant survival for all of these patients who needed us, and also teaching the world the lessons that we'd learned.
During my time as chair, and subsequently, I had the opportunity to found the Canadian Vigor Centre, an academic research organization that the university recognized as a center. We did randomized clinical trials, not only across this country, but in relationship to partners in 41 countries around the world. The University of Alberta flag and the Vigor Centre and what we've been able to do in terms of research and collaboration has been an exciting time, all from the position of being a University of Alberta faculty.
The University of Alberta put that package together to establish the Alberta Asthma Centre, but more broadly in lung disease and in inflammation. Over time, the Asthma Centre focused much more on patient education, very strong pediatric education programs for children, randomized controlled trials of those education programs in schools in Edmonton, Ontario, in Manitoba. And we were very proud it became recognized by CDC in Atlanta, Georgia as one of the evidence-based education programs for children in asthma. And it was also recognized by World Health Association as a high-quality asthma education program for children.